Genital fistulas are perforations between genital tract organs. The risk factors for genital fistulas include congenital anomalies, gynecologic surgery, obstetric trauma, cancer, radiation therapy, gynecologic trauma, and infection. The pathophysiology of genital fistulas include weakening of the pelvic support structures, which allows the tracts to form. The clinical manifestations and diagnosis, well, it depends on the fistula. If it's a fistula between the bladder and the vagina, there'll be a presence of urine in the vaginal vault. If it is a fistula between the rectum and the vagina, there may be flatus that passes through the vagina, feces in the vagina, odors of urine or feces in the vagina, or irritation to the vaginal tissues. The diagnosis is by a pelvic exam by the healthcare provider. The medical and pharmacological management, really the only way to correct a fistula is to have it surgically repaired. Polycystic ovarian syndrome. This is a syndrome in which the ovaries have multiple cysts on them, which have hormonal influences on the individual. Risk factors include pituitary problems. The pathophysiology of polycystic ovarian syndrome include an imbalance of high levels of estrogen, testosterone, and LH with a decreased secretion of FSH. It is an X-linked dominant or autosomal dominant trait. Clinical manifestations and diagnosis include obesity, hirsutism or hairiness, irregular menses or amenorrhea, and infertility. The patient may also have impaired glucose tolerance and hyperinsulinemia. An ultrasound, lab work, and endometrial biopsy are used to confirm the diagnosis, but many times healthcare providers actually diagnose PCOS just by the symptoms that the patient has. The medical and pharmacological management include encouraging weight loss through diet and exercise, and the pharmacological management includes oral contraceptive pills, gonadotropin-releasing hormone analogs, and the use of metformin. Leiomyomas or fibroid tumors. These are slow-growing benign tumors arising from the muscle tissue of the uterus. Risk factors include someone who's over 50, never been pregnant, being of African American descent, on hormone replacement therapy, or there may be a genetic link to them. The pathophysiology for leiomyomas is the uterine cells begin to grow and multiply in the presence of the ovarian hormones of estrogen and progesterone. Clinical manifestations and diagnosis include they may be asymptomatic, but the patient may complain of a backache, abdominal pressure, constipation, urinary incontinence, or dysmenorrhea. Diagnosis is made by pelvic examination and or an ultrasound. The medical and pharmacological management include NSAIDs for pain, gonadotropin releasing hormone agonists like Lupron, Depo-Provera, Danacrin, or Mefloprix. The patient may also undergo uterine artery embolization, which is the newest technique, which is showing some very good results, and surgery to remove not only the fibroid tissues, but the patient may undergo a complete hysterectomy. Bartholin cyst is the most common benign lesion of the vulva. The risk factors for the development of Bartholin cysts include infections from sexually transmitted infections or from E. coli infection. Pathophysiology, something, i.e. these bacteria have caused an obstruction in the Bartholin duct. The clinical manifestations and diagnosis, the patient may be asymptomatic, or they may have severe valvular pain, dyspareunia, or feeling of a mass in the valvular area. Medical and pharmacological management of Bartholin cysts include surgical incision and drainage of the affected cyst or systematic cysts. We also use sitz bath, NSAIDs, and heat lamps to help with the healing process. Endometrial cancer is the most common malignancy of the reproductive system. Risk factors include perimenopausal or postmenopausal women aged 50 to 65, obesity, nulliparity, infertility, late onset of menopause, diabetes mellitus, hypertension, PCOS, or family history of ovarian or breast disease. The pathophysiology includes the adenocarcinomas causing endometrial cancer developing from the endometrial hyperplasia. Clinical manifestations and diagnosis, the patient will complain of an abnormal uterine bleeding, which is the hallmark sign and symptom, a mucosangrenous vaginal discharge, low back pain, or low pelvic pain. A pap smear, endometrial biopsy, hysteroscopy, and vaginal ultrasound can help confirm the diagnosis. Medical and pharmacological management. Medical management includes a hysterectomy, which is surgery, chemotherapy, and radiation. The patient may also be placed on a progesterone therapy or anti-estrogen therapy to decrease the cancer because it seems to be estrogen dependent. Ovarian cancer, it causes more deaths than any other female genital tract cancer. The cause is unknown, but there are risk factors of nulliparity, infertility, previous breast cancer, family history of ovarian and breast cancer, Caucasian descent, or on hormonal replacement therapy. Pathophysiology of ovarian cancer includes the overgrowth of the epithelium layers of the ovaries. Clinical manifestations and diagnosis of the patient may be asymptomatic. They may have some abdominal bloating, an increase in abdominal girth, some pelvic or abdominal pain, difficulty eating or feeling full quickly, urinary urgency or frequency. The signs and symptoms of ovarian cancer are very vague and nonspecific. Early diagnosis is uncommon. Diagnostic screenings include a transvaginal ultrasound, looking for the CA-125 anti-estrogen gene marker, and pelvic exams. Again, the medical and pharmacological management includes surgery, anti-neoplastic drugs, and chemotherapy and radiation.